We're going to talk a little bit about the pelvis and the perineum. This is a topic that is going to return to us during reproductive, then also during gastrointestinal and urinary and neuroscience sections of this course. So that's why it's so important, and we're giving it this extra emphasis. This is a good opportunity for you to gain a three-dimensional understanding of the pelvis and the perineum, and this opportunity may not come for you again after this class. So first, let's talk about the skeleton of the pelvis. What you see before you is actually a male pelvis. The quickest way I consider to assess this is to look at the angle of where the inferior pubic rami come together. And we can see a sharper angle. I'll show you the female pelvis. Can you move over onto that? We can see a wider angle here at the pubic symphysis where the inferior pubic rami come together. Now back to the male pelvis. You can see the pubic symphysis here. I've already mentioned the inferior pubic rami, the superior pubic ramus, the ischium back here, and over here, not really great angle for it, the ilium. And you can also see here the acetabulum, which is where the head of the femur articulates with the pelvis. The acetabulum is actually composed of all three of the bones I mentioned. This entire bone is the os that is a merger of the pubis, the ischium, and the ilium. If I prop the pelvis up so you can see the ala of the ilium, the wing of the ilium, you can then also see the inlet of the pelvis. And on the opposite side, the outlet of the pelvis. One question I have in class a great deal is actually about the true pelvis and the false pelvis. In order to understand that, first you have to see the pelvic brim. The pelvic brim is composed of the pubic crest and the arcuate line back on the ilium. Why do we say true pelvis and false pelvis? When just looking at the skeleton, one would think everything contained within the wings of the ilium and down here contained by the pubis and the ischium is the pelvis. But this area above the pelvic brim in the living human actually contains abdominal organs, and it is below the pelvic brim, or inferior to the pelvic brim, one would find the pelvic organs. That is why we say false pelvis above the pelvic brim and true pelvis below the pelvic brim. Here we've switched to a articulated pelvis and articulated pelvis where we have the ligaments still intact. And if you look, we're looking at the external aspect of the left side of the pelvis. And you can see a foramen here. We call this the greater sciatic foramen. And that is composed of the greater sciatic notch, which you know from looking at the skeleton, and the sacrospinous ligament. The sacrospinous ligament is from the sacrum to the spine of the ischium. Then we have the sacrotuberous ligament, which is from the sacrum to the ischial tuberosity. With these ligaments, we turn the two notches, the greater and the lesser sciatic notches, into the greater and the lesser sciatic foramen. I emphasize these because when we start talking about vasculature and about the nervous system, we're going to learn that a lot of this passes through these foramina, such that the sciatic nerve exits the pelvis via the greater sciatic foramen. Many arteries and other nerves we'll learn about at a later time do as well. Other nerves and arteries that exit through the greater sciatic foramen may then actually re-enter into the perineum, more on what that is in a moment, into the perineum via the lesser sciatic foramen. So they would take out of this foramen, back in that foramen, into the perineum. Now I'll mention more detail on what the perineum is in a moment, but the perineum is what's inferior to and superficial to the pelvis. I'm going to switch models. Back to the plastic female pelvis. Before we talk any further on pelvis and perineum, we're going to have to introduce some idea of the muscles in the area. And if we look back at the anterior aspects, such that we have the pubic symphysis right here, the inferior pubic rami, there is a muscle, a group of muscles, that covers from one ramus to the next, and that is called the urogenital diaphragm. This is not to be confused with the pelvic diaphragm. The urogenital diaphragm is a triangular shaped diaphragm, as we say, from one pubic ramus and ischial ramus to the opposite pubic ramus and ischial ramus. And we can see how that would be a barrier and a diaphragm. We have another model we'll switch to on that in a moment. But I want you to see this in contrast to the pelvic diaphragm. The pelvic diaphragm is somewhat like a parachute type of muscular structure that anchors around the area of the pelvic brim, just inferior to that pelvic brim, so that you can see it actually forms a floor of the pelvis. This is the actual floor of the pelvis. There's no skeletal floor of the pelvis. It is the pelvic diaphragm. Now let's look at it from the inferior side. We'll put it back into place a little better here. As you see, from the inferior side, you can see deep to the view we had a moment ago, deep to these pubic rami, you can see the pelvic diaphragm. The main muscle of the pelvic diaphragm, by the way, is the levator ani, which you will see is marked on your lists. Now, the difficult part is the relationship between the pelvic diaphragm and the urogenital diaphragm. Let me put the urogenital diaphragm back in place, and we can see once again a triangle between the pubic rami. If I rotate so we have a posterior view, we actually see the anus and the vagina coming through the pelvic diaphragm, and you can see there's actual space between the urogenital diaphragm and the pelvic diaphragm. So this is primarily the levator ani as far as we're going to go, and we're going to say urogenital diaphragm for this muscle group here. Once again, of course, the anus and the vagina or the urethra of the male, of course, have to penetrate through the urogenital diaphragm, but we can cover that in greater detail with other models in person. The point I'm trying to get across right now is to understand that there are two different diaphragms we're talking about down here, the pelvis and the urogenital diaphragm. Now, back to comment on and review what we said earlier. Recall what we said about the true and the false pelvis. You can see now the wings of the the ala of the ilium here, down to the pelvic brim. That is the false pelvis. This would house abdominal organs, the lower intestines. Below here is the true pelvis. We would find the pelvic organs such as the prostate gland and cervix. Down to the floor of the pelvic diaphragm. That is the floor of the pelvis. If we go superficial to or inferior to the pelvic diaphragm, out here, we're now in the perineum. If we go anterior to the line I've drawn here between the ischial tuberosities, we are up in the perineum. It's perineum back here as well, excuse me.
Hello students, once again here we're going to do a little map of Atlanta, and some of you may recognize this as 285, and here is 75, and here's 85, yes, the highway, and here's 75, 85, and so this is sort of like the downtown area. The reason I bring this up is it's a really great way to think about how the acetabulum is oriented. And so if we can shift over at this point, it is exactly the same thing. If you think of a peace sign or 285, here's the round circle is 285. If you designate this as Atlanta or right in the center, and you kind of draw a line that is, let me turn it just a little bit, a line that is straight down that actually bisects this inferior pubic rami. So if you draw a line straight down like that, and then you have one here and one here, these would be sort of like that peace sign configuration. Let's look at each of these. This is a way to determine whether you're looking at ischium, ilium, or pubis. So for instance, right here, this portion back here is ischium, and you can see that that's how that's where the dividing line is, right halfway through here and halfway through here. This is ischium. If we then look at everything that's, let me just move this up, hopefully this is, you're getting this, everything from here forward is pubic. So that is actually all pubic bone, and then everything up in this portion is ilium. So just think about that upside down peace sign, or that peace sign rather, and put it in the center of the acetabulum, draw your lines, and you can get a really good idea of, if we pointed, which portion of the that we're speaking of. So again, ischium, pubis, or ilium, based on this central little drawing. Hope that helps. Bye-bye.